Ubezie, a professor of pediatrics at the University of Nigeria and an honorary consultant pediatrician at the University of Nigeria Teaching Hospital. He is a fellow of the Medical College and West African College of Physicians in the Faculty of Pediatrics. He holds a master's in public health degree from the University of Liverpool. He also holds the Doctor of Medicine degree of the National Postgraduate Medical College of Nigeria. His career path has focused on public health issues affecting children in resource-poor countries, such as HIV and malnutrition. He previously worked as a pediatric clinical advisor and later regional team leader for the International Center for AIDS Care and Treatment Programs, ICAP, Columbia University. He was a visiting research scholar at the Cincinnati Children's Hospital Medical Center and the University of Cincinnati, Ohio, USA, in 2012 in the Division of Gastroenterology, Hepatology, and Nutrition. He is a past secretary of the Pediatric Association of Nigeria. He is also a past secretary and the current third Senate member of the Faculty of Pediatrics, National Postgraduate Medical College of Nigeria. He has presented papers in both local and international conferences and has published over 70 peer-reviewed articles. And so, ladies and gentlemen, let's make welcome our able professor, a man that's knowledgeable and a teacher who will be speaking to us on how to excellently defend our dissertations. So you're welcome, Prof. Please take the stage. Thank you, sir.
Thank you so much, Gloria, for that generous introduction. And I'll just quickly put this on slideshow and we go. It's going to be a very brief presentation. The tone of presentation is such that it will benefit those still writing their dissertation. But I think there may be one or two things for those presenting for exam, this diet may glean from it. Why? Because defending dissertation starts from a well-written dissertation. And basically, what I'm going to do is share with us my experience as an examiner in part 2, a couple of years now. What I have noticed, what makes the difference between pass, provisional pass, and referred dissertation. What I think examiners are looking out for, what I'm looking out for when I'm reviewing a dissertation, what other examiners are looking out for when they're reviewing dissertation, the nuances, what makes the difference. And I can tell you that a lot of time, the difference between pass and fail is so thin. You need to articulate your thoughts, your thesis, your dissertation in such a way that you cross that line and cross to the other side of pass. So what's a dissertation? It's a formal lengthy research paper written as a requirement for an academic degree. In this case, Fellowship of the National College or West African College of Physicians or West African College of Surgeons. But more importantly, dissertation seeks to demonstrate original research. I put out in red, it's your work. It has to be original. Copying from other people's work, which has happened in the past, plagiarism is a huge problem. And both locally and internationally is an unpardonable sin. So it has to be original and devoid of any plagiarism. For us at the National College, we set a benchmark that similarity index must not be more than 30% for it to meet that benchmark of originality. If we put it on Turnitin and it turns out to be more than 30%, it will be flagged. And then that becomes a huge issue during the exam. And then again, what also we need to know is that that dissertation must contribute knowledge to a specific field. You set the exam, you choose the area you want to work on, but there must be an intention to contribute specific new knowledge to the medical community. So a dissertation is typically structured this way. There are other little details, but basically it must have preliminary pages, introduction, a literature review, a methodology, result, discussion, conclusion, recommendation, and then references. So pre-defense, before you present to Ibadan, Lagos, or wherever you are going to defend your part 2 dissertation, the book would have been sent to 2 examiners well ahead of time. Very soon, for those that are going to examine for us at November National College, we send the books to them, and they will read and have a verdict even before the exam. So the verdict could be pass, which is read though, or provisional pass, when they think the correction can be sorted out within 3 months, and then convert you to full pass. sometimes it's provisional pass subject to your performance at the exam. So what that means is that they're undecided. They've read that. They think you have a case. You have a good idea. You should be able to pass, but they want you to give a good defense, and they cannot convert that to provisional pass. And then sometimes it's outright referred, and they made up their mind. No matter what you're going to say in the oral defense, you're not going to pass this dissertation. And they rejected. I put that to red because we battled that and decided that it should never happen. That if a proposer has gone through approval process and then present a dissertation, rejecting it at that point is unfair to the candidate, it's unfair to the faculty, it's unfair to the college. And so for a couple of years now, we haven't had any dissertation rejected at that point. Because rejection simply means you need to go back and start all over again. That's quite traumatic. So what we're saying in essence is that a well and carefully written dissertation will likely give you a favorable verdict, even before you sit down to defend that. And particularly for those doing MD. So 70% of the marks are decided before you present for defense. The defense contribute 30%. That means most people may have even passed the exam even before they sit down to defense. What they're looking for at that oral defense is just 30 marks. The 70% have already been scored. And that's why it's important that we pay careful attention when we are writing our dissertation. So I'm going to, in the course of this talk, glean on some of the common errors. I went back to all the reports I've written, a few of them in the past few exams, to look at examiners' report, look at report of the candidates I've written in the past and summarize them in different thematic areas, which we're going to discuss. But then let's go on. So the defense proper, that's the final oral examination for a doctorate degree, those in MD or for fellowship, where you present the candidate, their work, their research work to a committee of experts known as examiners to demonstrate expertise and answer their questions. The question can come from any angle and from anywhere, and they have no apology because you set the exam for yourself. You must show mastery of the subject. On the average, it lasts for about an hour. It could last a little longer than that. And the question could be in every area of the subject. So if you are working on childhood malnutrition, you should know everything about it. If you are working on bacterial meningitis, you should be the expert. If you are working on abdominal surgeries, you should be the expert on everything about abdominal surgeries. You know, if you are working on HIV and AIDS, nobody, not even the examiner, should know more about HIV and AIDS than you. So whatever subject you decided to research on, you are the expert. I must demonstrate, show expertise and mastery of the subject. So I said that, demonstrate mastery of the subject, an exam set by you. Nobody asked you to do it. The faculty, the college didn't give you a topic to go and research on. You sat down with your supervisor, decided to work on that specific area. So you are the organ, you are the expert. You set the exam, and then they are judging you based on the standard you set already. So successful defense is usually linked to a well-written session. I've said that. Examiners most times have had verdict who said that, and they are thorough. What I've also seen is that candidates present for the exam with so much carelessness and thinking that certain things will not be seen, will be overlooked. They see everything from page 1 to the last page, and those can be really serious issues. So the general tips when you are presenting for oral examination, dressing is important. You are being examined to become a consultant. You can't afford to be shabby. Be neat and formal. If you're a man, wear a jacket. If you're a woman, dress formally. And you passing that exam makes you a consultant. So you are sitting that exam as a consultant. You are working out from that room, a fellow, a consultant. So they expect you to dress in that sense. Be audible and compose. Yeah, we have to be nervous. Everybody, whenever it has to do with exam, even when you are so smart, there are some nervousness that comes for all of us. I mean, but think about it, you've been through exams from secondary school, primary school to various MBs, to primary, to part 1 and here. Yeah, so that nervousness should be checked and put in control. And you can't allow that to overwhelm your sense of judgment and become so obvious that they don't think highly of you. Being a consultant comes with so much responsibility, and they want to be sure that you're walking out of that room to carry that weight of answering the consultant. So be audible, be composed. The examiners are human. They don't know everything. You know the book more than they do, but don't be arrogant, be courteous, be polite. Offer apologies where necessary. They point out a serious omission and error. Don't go argue. And sometimes some candidates sit back to argue, and they will sit back and watch you argue. When you're tired, you move on. But when they have the verdict, they have the answer, they have your future in their hands. So even when they are erring, they are making mistakes, find a way to be courteous in responding with facts. So I put this again. We use this typically when we are examining candidates for MD. That's to underscore the point that we look at personality, we look at your communication and the exposure, and then your delivery and ability to answer questions. These are all scored. And then we're working hard to also learn this, to use it in all form of defense of dissertation. So what are some of the flaws I've noticed in the past? Insufficient mastery of the subject. So they will start, tell us about your work. Some candidates start fumbling right from there and tumbling. If you can't summarize your work, then there's no basis for awarding you a pass, a provisional pass. You should be able to give summary of your work in a concise way with sufficient details and sequence. So if they say, tell us about your work, say, in this work, I found that there was 20% prevalence of malnutrition. No, be methodological, be systematic. Give a context, a background of this work, that this is the work, malnutrition is a problem in Africa and in Nigeria in particular. Under 5 children bear the brunt of it. There have been many studies in Nigeria of malnutrition, but there is a gap. So identify a gap. We are not doing research to replicate what has been done elsewhere. We are doing it because we want to address research gap. What's the gap in the literature necessitating your own study? And then get into the aim, general aim of the study, your method, your result, your conclusion, and recommendation. You can't do this for the first time in an oral defense. You must have practiced several times before exam. So the assumption many candidates do, which is so wrong, is that they write dissertations, submit to the college, go ahead and keep rehearsing and preparing for oral and doing discussion without ever looking at that books. Put the same energy you put to prepare for oral in also preparing for defense. So if you have practiced that over and over again, how to summarize your work, it will flow naturally. When they ask you, tell us about your work or summarize your work, you won't fumble, but you are likely to fumble if you want to do it for the first time during the exam. Then eloquence, confidence, be audible. So eloquent, we are not all orators and we can be. But again, practice made perfect. If you look at yourself in the mirror every day and present your work to yourself or present to your peers or present to others, you are going to come out better. Be confident in yourself. I think we should all tell ourselves as somebody we've come a long way. We've read so many books, more than any person in this, more than any group of persons, whether they're lawyers or engineers. We've read the big, the small, all sorts of books. So be confident that you know something, particularly when you set an exam, which is dissertation for yourself, and be audible. Sometimes you keep telling you, we can't hear you, we can't hear you. They can't judge you based on what they didn't hear. So you have to be audible. You have to also avoid certain mannerism, flipping through paper back and forth. Think about it. If they ask you to tell about your work and you just close that book for a second and speak about your work accurately without opening that book, it forms a huge impression, a big one, a positive one, that if they're sitting on the fence, they're making up their mind. I think this candidate is good to go. He or she is desirous, eligible, qualified to be a consultant. Anticipate questions and prepare for them. Sit back, look at all the things you've done, possible questions, different area, and prepare the answer. The chances are 50-50. Those questions you have prepared about your dissertation will likely come up during defense. So I listed here a couple of things I've seen over and over again in defense. Grammatical, typographical, and syntax errors. So it's not peculiar to me. It's a common thing about all the examiners. It's very often, from my experience, from experience of others, and this is very pertinent when dissertations are written in a hurry. So you are going for exam in May 2026. You've not started writing the dissertation. By December, you are scribbling and you're writing and you're hurrying and all that. By March, they're asking you to submit. You submit in a hurry and then it's not good enough. They're mixing up tenses. So what I also noticed, not once, not twice, is that people write their proposal, and when you are writing proposal, usually in future tense, I will do this, I will do this, and they just go and copy the result and put in that proposal copy the discussion, put in that proposal. So when you're reading the whole dissertation, you are still seeing, I will do, I will calculate sample size, I will enroll this number of people. It tells very badly about the candidate. British versus American spelling. We were colonized by the Britons, so we can't run away from it. Ensure that you use British style in spelling and not the American spelling style. Different font size and no double spacing makes for difficult read. They frown at it. I understand that English is not our primary language, but one of the things we can do is to have peer review. It mustn't even be a doctor. It could be your spouse if it's not a doctor. It could be somebody you know that is good at English. It could be a house officer. It could be a registrar. Look at English. They may not be able to critique the substance of the work, but they can give you an idea and be humble to take corrections from anybody and anywhere. So give it out to people to read and they give you their feedback. And then if you are submitted and you are reading and you notice some error, write all of them down and print them before the defense. We'll talk more about that as we go on. So let's look at the title. Generally, the title of our dissertation will be acceptable to the examiners because it's been approved. It's gone through proposal review, been approved by the examiners, and colleges have written you that you have an approval to do this work. But the reality is that sometimes one of the examiners that approved your proposal may not be sitting in the exam. He or she may not be disposed to come for the exam or, shuffling things, trying to balance examiners, everybody can be invited. So when you have limited examiners like we do have now because of the cost and the number of candidates, there is a chance that people going to assess you, only one of them may have read the proposal. The other examiner may see things from a different, entirely new perspective, may disagree with your title. It happens. And you have to go back to your original idea and concept. You may be right, or you may not be. If you think it's making a sense, weigh in and comment appropriately and respond accordingly. Find a way to wrinkle out of it. You can say, well, I agree with you, sir. And however, the point you made, you have been taken care of by limitation of study. Okay? So be careful what you respond. Don't go arguing about it. Sometimes they may not be right. So it may have been a proposal that you have a topic, you presented it, the assessors change the topic for you, and the new examiner is asking you to go back to the original topic. You can politely point out, yes, sir, you're right. That actually my original concept, and I totally agree with you. However, when the proposal was being reviewed, the reviewer suggested that we have to do this to make progress, and that's why we're where we are. Be courteous, be polite, and address that. Don't stay on that, and they'll ring the bell and say time is up without defending your book. And very importantly, they have ego. Don't bruise that ego. Don't argue, don't prove your point. You are not there to prove your point. When you get your fellowship, you can now argue with them from now till thy kingdom come. You can challenge them anywhere at conference meetings. You can raise their hand when they are presenting paper. They hold the key, they hold the S's at that room. Find a way to get out of the conundrum and move on with your life. The summary, particularly at the National College, usually, earlier on, nobody bothers, structured or unstructured. But National College insists now that summary should be structured, background, aim, methodology, result, conclusion. And the work count should stick to 500. I was just, again, just before I started this meeting, looking at one of the MDs I reviewed, and where the summary was, I can say almost 1,500 words. That's not a summary. Summary means that you're able to bring all your idea. It's also part of the training and the skill. Bring all your idea and study in such a comprehensible way, but still makes sense. And a common error is missing key points. People make summaries without putting things like ethical consideration, data management. Summary is not just the result. Summary is not just the methodology. Summary is everything about that work in an abridged format and should be as comprehensive as possible. Introduction, most time when your proposal have been approved, nobody will really bother so much about introduction. But remember, proposals are typically approved in a hurry. So they expect you to do more when you write your dissertation, and don't take it as final. So look back at your introduction. Do you have regional and local data in introduction? But what people look out for, what is the gap in the literature that this study is trying to fill? Once it's not there, it's a red flag. And then we can incorrect justifications, where it's just a mere repetition of the introduction. Justification should explicitly state why the study is should pass, should go on, should have happened. You are looking at maybe well, that may not be a perfect example, antibiotics, the microbiology in acute bacterial meningitis, for instance, and you want to do that study. People have done that severally, but your justification can be, yeah, there have been many studies here, but a lot have changed in the past decade. There have been new vaccination addressing key microorganisms that cause meningitis. And then beyond that, a lot of antibiotic abuse has been happening. You go back and look at what has changed since the series of studies that happened. I used to justify the present study, why you think that this study is important and why you should watch the why. Objective, usually well approved, smart, but they look out for that again during defense. Are they specific? Are they measurable, achievable, relevant, and time bound? So usually as approved, they don't want to go on that. But again, sometimes there are grammatical error, there are inconsistencies, and they point that out as well. Hypothesis. A lot of time people state the non-hypothesis without stating the alternative. It's not acceptable. Literature review. I can't remember any book I've examined in recent time where candidate has sufficiently critiqued cited literature. And I think the reason is obvious. So they write the proposal. When they're choked with time, they just leave that literature review as in the proposal and submit it for final defense. How can that be? Since you submitted the proposal, new papers have been published. You need to update your literature. You've gained greater insight on your work. You need to go back to literature review and expand your view. So we must go back on literature review and do a thorough job when we're writing our dissertation. Must be updated after approval. And then scanty and not comprehensive. Literature review must review every specific objective you set out in your study objective. And they mix up an omission of references. Some references are upside down, mixed up, and all that irritates the examiners. And then when literature review also lack focus, it's also an irritating factor. You see a study, for instance, you're a pediatrician, you're doing study in children, and your literature review is mainly on adult study, and vice versa. You're an internist, you're internal medicine, and you are reviewing literature basically on children. There may be reasons sometimes to include literatures, broadly, but there you shouldn't lose sight of the focus of your constituency, area of study. Study is relevant to your dissertation, and the literature review must be reviewed along the line of your specific objective. I said that already. Then, very importantly, failure to review literature on study tools. So if there are tools you are going to use in this study, whether they are laboratory tools or questionnaires, standardized questionnaire, you should review literature on them, talk about their specific, talk about their sensitivity, talk about why you chose the one you use for your study. So in reviewing literature of those tools and methods, you are bringing to fore why you did what you did, why what you did is should be the gold standard. So things you use for your study can't just appear for the first time in your methodology without having reviewed them in your literature. That's not acceptable. Then let's go to methodology, some of the common flaws. When we include data with no bearing to the studies, so we see commonly people set out objective, go to the field and collect all manner of data. So in their result, you are seeing the weight, you are seeing the height, you are seeing the blood pressure, you are seeing all sort of things. There is nothing like that in the objective. It means you don't have focus of where you're going. If you think those data are important to you, why didn't you expand your objective to include them ab initio? Then mixing up of statistics. I just use mean and median to illustrate, but it cuts across all statistical too. We are not statisticians, but seek the help of statisticians. When you don't know when to use mean or use median, when you don't know that continuous variables should be subject to normality tests, then those are basic statistics, and that's really a huge problem. Then failure to define your key terms. I use this as an example. For instance, somebody doing a study on vitamin D, and you are interpreting your data deficient, insufficient, sufficient in your resource section. You never define that in methodology. And let me quickly say, I may still say it again, that once there is a flaw in methodology, that dissertation cannot pass. They can forgive your literature review, forgive your introduction, prohibit your result, close their eyes on discussion. But once there is a flaw in the methodology of the study, then it's a huge problem and they will not let you go. Then presenting inclusion criteria as opposite of exclusion criteria. You set out an inclusion criteria, for instance, I'm going to recruit children that are age 1 to 5 years. And the exclusion, you said, I'm going to exclude children less than 1 year and children more than 5 years. That has already been applied in the exclusion criteria. That shouldn't be the exclusion criteria. Once you set out 1 to 5 years, that covers less than 1 year and more than 5 years. Unclear criteria for selection of your study participants, especially when we are doing multi-stage sampling, you are going to schools, sampling different pupils. You didn't clearly define how you were able to select 50 from school A, 100 from school B, 120 from school C. It must be methodological, it must be scientific, and that must be strictly adhered to. And then I've talked about presenting and collecting data not aligned to objective. Issues around sample size calculation, using a wrong formula. You are doing a comparative study and you are using formula for prevalence study. And once they fault that, it's a huge problem. I said that again in red. Flaws in methodology is serious and it's an unpardonable offense. So when we get to the result, this is another common error when people are defending their dissertation. When they mix up result and discussion, there is a thin line. But always see result as where you present your data and nothing but data. So result is result. Results are about data and your research finding. Results are numbers and proportion. When you use words like more, higher, lower, less, all of those in your result, you are etching into discussion. Leave those when you get to your discussion, talk about it was higher here, it was less here, and give your reasons there. But when you're on the result, stick to the finding. 20, in bracket, 5% of the study participants had anemia. Don't talk about which was lower than this or higher than that. Leave that for your discussion. And then poorly formatted detail, numbers not adding up. You have a table that you add up to 100. When examiner punch their calculator, it's adding to 101. You know, that's not acceptable. You have abbreviations in your table. There are no footnotes, not acceptable. Repetition of entire table as prose. So you have a whole table and you write a whole prose, including all of the things inside that table as prose. Why? Why are you having tables? So the prose should just highlight the key findings and then refer the reader to the table. So 67 participants, in bracket 30%, had a severe high blood pressure, as shown in table 1. The rest of the things should be there in the table. And when you are looking at picking prose from the table, focus on significant findings, if there are, and pick those significant findings and write them in prose, and then the rest of the detail, refer them to that particular table. So absolute figures and proportion. When you begin to publish papers, find out that one of the ways to tell lies in research is using percent, 20%, 30%. 20% of what? 30% of what? Remember that 4 over 10 is 40%. 40 over 100 is still 40%. So most examiners will want you to combine, give a context, write the number, and write the proportion in bracket, so that you don't confuse people with the percentages. Tables must be labeled with Roman numerals. Unit of measurement. You took heights and you just write height. 160. 160 was centimeters or meters. I mean, these are common things I've noticed over and over again, reading dissertation for exams. Put the unit of measurement. Blood pressure, millimeters, mercury, weight, kilogram, whatever. Put all the units there. Then variables not previously defined. So you are getting to result. You are seeing variables, underweight, hypothyroidism, hypoglycemia. They were never defined previously in methodology. It gives a bad taste to the listeners and readers. The discussion, lack of sufficient depth. You couldn't have done a dissertation and you're presenting 5, 6, 7, 8 pages of this discussion. That's not sufficient depth. And discussion, you go back to your study objectives and align your discussion to each of those objectives. They must be discussed one after the other and avoid repetition. Repeating yourself, reading, somebody is reading, you are saying the same thing over and over again. It doesn't sound right. And then people will come back to discussion and start repeating results. I read a dissertation. The whole first page was just about all the figures and data previously presented in the result. There's no harm in summarizing your result in a paragraph. But then don't begin to rewrite result again in discussion. Discussion should focus on your finding. Discuss them, how they differ from previous findings, and what are your comments or your thoughts on your own findings, which takes us to poor interpretation of data. There's a difference between absolute numbers and statistics when you are setting up your study hypothesis. So 6 may be higher than 4 mathematically, But in statistics, there may not be any difference. So you looked at the data, you've compared the weight of two groups of people, and the mean for group A was 20 kg, mean for group B was 22 kg. You put that to statistical test, and P was more than 0.05. It wasn't significant. Don't come to your discussion and start talking about weight was higher in group A. It wasn't higher. Your statistics said otherwise. There was no difference. That's what you should be discussing. What you should be talking here is the alternative hypothesis that there was no difference between the weight of group A and group B. But a common thing is that people look at absolute number. Go back to discussion and begin to talk about those absolute numbers as higher. Research is about statistics, not mathematics. And then your recommendation quickly must be based on research findings. So if it's not based on your research finding, sometimes we are looking for conclusions to anywhere. Go back to your objective. Look at that. Each objective, look at have you met that? What do your findings say? And follow that. Align your conclusion and recommendations to your study objectives. And then referencing must align with Vancouver. If you are in doubt, what is Vancouver? A good example would be Nigerian Postgraduate Medical Journal. Always refer to that. And then ensure that majority of your cited work are not old papers. When we say old, more than 10 years. Appendices. I've seen this severally. People start work for some reasons, you didn't finish on time, you continued, I present your exam, and you're presenting an ethical approval that has expired. It's a simple thing. If you couldn't finish and it expired, go back to the approval committee of your institution and get an extension. And they will do that for you. But you are presenting for exam, maybe this November exam, and you did an ethical approval that expired in 2023 or 2024. They will raise an eyebrow and incorrectly label appendices. So you are having appendix or whatever it is in your work. And when you get to the appendices where they are listed, it's telling a different story. You must cross-check all that as well. So my closing remarks, ensure you are ready for the exam. It has cost implications. It's expensive. Don't hurriedly put up your dissertation and then present for exam. The cost of transportation to Lagos or about anywhere, the cost of registering for the exam, cost of accommodation, coming to the exam with a shoddy work is not worth it. Review your dissertation several times, even after you have submitted it, and have a mock defense. I recommend whatever institution, if they are not doing it, meet your head of department, request for a time to present your work, get a peer review. When people look at your work from different perspectives, they'll point you to the direction of what you probably haven't seen. And beyond that, also present to people that didn't supervise you, give them your work to read. So your supervisors have been fixated in one aspect of your work. When you give it to other people to read, they can give you insight and perspective that you never thought of. And then if you have submitted a noted error, or print all of them before your defense, bring them to the exam. They will ask you for it, present it politely, and apologize. So I pause for questions if you have any. Thank you so much.
Thank you so much, Prof. This is a very concise and straight to the point presentation, very rich. Thank you so much. I know it will benefit all of us, especially those that are going for this October, November exams. So thank you so much, sir. I don't know if anybody has a question. You can put it up on the chat box, or you can unmute and ask your questions. Any questions, please?
Hello, good evening, Prof. Thank
Good
you very much
evening.
for a concise and wonderful presentation, sir. I have two questions. First, I want to ask about labeling tables. For my own book, for example, I had a table in chapter 1. I had another table in chapter 2. Then when it came to my results, I now started the tables. So someone was saying I should have labeled my tables as the first table in chapter 1 as 1, the second table in chapter 2 as 2, then the tables in results as 3, 4, 5, 6 consecutively like that. Another person said no, that the tables in results should be reflecting table 4.1, table 4.2, irrespective of the other tables in the other chapters. So I would like your insight on that, sir. The second question I have is with respect to the MD program, because I know that the word count is 50,000 words. So sometimes if you just follow your research objectives, you might not really meet up with that count. So sometimes your statistician could tell you that, okay, from this data that we also got this, we found this, we found this. So there's a temptation to want to use all that information and write it up, even though it's not part of your objectives, to build up that word count. Is that allowed or not? Thank you very much, Prof.
Thank you so much. I think this is an excellent question. I'm happy you brought them up. So the first one, the first person that advice is correct. It's your dissertation. There's nothing like table 4.1, 4.2. At National College, we don't even label table that way. It's really labeled table I, and I pointed out in the talk about Roman versus Arabic numeral. Tables are labeled as Roman numeral and figures as Arabic numeral. So if you had a table in chapter 1, that's your table I. Another table in chapter 2 is your table II. When you get to result, the first table become table III, and on and on and on. That's what is acceptable, at least to National College. And I think West African College as well. That's the standard practice. Other colleges or institutions around the world may have a different opinion, but this is what we accepted. Then the second point is also valid, especially for MD, where you must write 50,000 words. In fact, when you submit your MD thesis, it's screened for that. So if it's less than 50,000 words, it's not even being sent for exam. You are not going to be invited for exam. And how do we get around it? Getting around it is not by including data that you originally didn't set out to work on. That's a simplistic but unacceptable way of doing it. So the way, maybe I can share that with us offline, whatever. There are proportions of that 50,000 words that go to different sections. For instance, literature review has a large chunk of that 50,000 words. And how do we do that literature review? So it's your subject, and any subject you're researching on, you can play around literature review. What happens to historical perspective? What happens to various thematic, because it's an expert work. Whatever you are working on, maybe let's take malnutrition. You can go to town, go to the history of malnutrition, go back to various terms about malnutrition, and then zero in on the aspect you are working. Or you're working about thyroid hormones. Go back to the anatomy, the physiology, the various pathologies of thyroid hormone, and on and on and on. And what you pointed out is a common error. I've seen that for us, I'm a pediatrician, because we do seminars for candidates. We try to get around that before exam. But I also serve as external examiner at the Faculty of Internal Medicine in their MD program. Consecutively, when I get to the exam, that's what candidates, a common flaw. In attempt to get to 50,000 words, repetition is there, including data that were not originally sought out is there. And when you ask them, they say they're looking for 50,000 words. We want you to get 50,000 words, but get it in the right way. Thank you so much.
Okay, thank you so much, Prof. Thank you for that clear answers. I don't know if anybody has.
There's a question on chat box from.
Okay.
Okay, go on. I wanted to. There's some questions on chat box.
Okay. Let me take them, or would you prefer to read them out?
No, go ahead. Go ahead.
Okay. I think the first question here says, thank you, Prof, for this concise lecture. Please, how many months or years do ethical approvals stay before expiration?
So no, it's not about how many years you stay before expiration. It's about what your institutional review committee approved for you in that certificate. No institution will give you endless approval to keep on using their subject or even subject anywhere for research. It's time bound. And they will state that they can say January 1, 2025 to December 2027. So, but when you are writing up your study, and it's noticed because sometimes when you are writing the duration of study, you state when you did your study. When we go back and look at when you did the study and realize that you went on and kept on collecting data, even after that certificate has expired, you have breached ethics. you have breached ethical protocol. You have gone on to keep doing the study, even when you should have stopped. And the simple thing people do that is to go back and they request for an extension. And the institution will give them another extension letter. Remember, sometimes you get approval, write proposal takes forever. By the time it's coming, well, 1 year has gone. By the time you're starting, that certificate has expired. What I'm just saying is that, think about it. If it has expired, don't think they will notice that, and you go on and complete your study and present for exam. They will pick it up. Thank you.
Okay, thank you, Prof. I think the next question here, concerning the ethical approval, after it has been approved for the proposal, after how many months does it expire before dissertation? Okay, I think this person is asking the same thing. I was just answered now. So the next one is, after collecting samples within the time given for the ethical approval, the time would have expired before going for part 2 exam. Okay, I think that's a continuation.
Yeah, I think we've addressed that.
I understand. Yeah. Okay, yes. So person should go for an extension. Thank you. Okay. Any other question? All right. In the absence of any other question, I would want to appreciate you, Prof, for taking out this time to educate us on the common errors that candidates do make during dissertation, during exams and dissertation defense. Thank you so much, because it's an eye-opener, and I'm sure that a lot of us here have benefited from this, and it's going to help us a lot in preparing for our exams and dissertation. Thank you so much. We really appreciate it. On behalf of ARD, we want to
thank you, Gloria. Thank you, everybody, for having me.
Yeah. Thank you. Thank you so much, Prof.
And for those coming for exam in October, November, I wish you all the best. And thank you.
Oh, thank you. Thank you so much.
Thank you, sir.
Thank you, sir. Thank you for your time. We are grateful.
Thank you, sir.
Thank you, sir.